Pleasure to welcome all the participants for another IDF Thursday organized in this holy month of Ramadan. I want to thank each and every one of you for being here with us today. We are fortunate to have the support of our ministry directors, teachers, and staff of All Akhawain University IDF team, whom generously helped us to connect to succeed in enhancing knowledge activities. I also would like to welcome and express my sincere appreciation to Dr. Youssef OUKHALLOU for accepting to animate this webinar and to share his knowledge and based research about policy evaluation for decision makers. I'm convinced that the main outcome of this gathering is to come up with an area to improve our English, but also our knowledge in many fields, especially those related to our ministry's mission. This webinar sheds light on the modern policy evaluation tools used by prestigious universities and institutions worldwide. MIT, Harvard University, GPA, to demonstrate their adequacy to public finance evaluation in Morocco in the light of previous international experiences. The webinar is also meant to motivate the importance of those techniques in the policy-making process in Morocco. It is certainly a very technical topic, but I'm sure that Dr. Youssef OUKHALLOU will simplify the concepts by providing some examples for their use in practice. At this stage, I would like to introduce Dr. Youssef OUKHALLOU. So, Mr. OUKHALLOU, you have a Master in Economic Development and Policy Analysis from University of Nottingham, PhD in Financial Macroeconomic, Mohammed V University of Rabat, winner of the UK's government's Chevening Scholarship Award for 2018-2019. You were an economist and controller of public procurement in GTK. You have just succeeded in the exam of finance inspector. Congratulations. You are winner of many prizes and distinction. So you have several publications, activities such as associate editor at Nottingham Economic Review from UK, and president of Moroccan NGO of Young Decision Makers. So you are welcome. Before to conclude, I just want to point out that the presentation will last 30 minutes, and we will allocate 30 minutes for the discussion. Of course, we can have 10 minutes plus if you want. I sincerely hope that you will enjoy this time, and I request all the participants to make use of this moment to the best of their abilities. So do not hesitate to debate after the presentation. Without any further ado, I will give the floor to Dr. OUKHALLOU. Thank you.
Thank you very much. It is an honor and a privilege to be here among you. And I thank you for this opportunity for me to share a little bit of the little knowledge that I know about policy evaluation with my fellow colleagues. Hopefully, it could be the start of generating new ideas and maybe inspiring some of our colleagues to maybe adopt some of those techniques. So I will share the screen with the presentation to make it, with the visuals. Can you see the?
Yes.
Yes. Okay. Excellent. So before I start, I would like to thank Madame Sonia Hmamouche for the initiative and for the kind introduction. That was very kind of you. And let's get started, shall we? So policy evaluation for decision makers, as neatly put by Madame Mamouche, it's a series of techniques that are used by advanced research centers and universities, and also it is more and more used by governments in order to come up with the best ways to assess the policies and to choose the best ones for their respective objectives. Why we need why do we need modern policy evaluation techniques in the Ministry of Finance? In general, we need those techniques because they enable to evaluate policies in the best and the most efficient way, which enables, again, the decision makers to choose the best ones or the most effective policies. This is in general. But in the case of the Ministry of Finance, just to go into a few more details, maybe one of the triggers of this requirement of doing this transition towards a more modern evaluation techniques is the limits of the current framework. I have an example here. For instance, the industrial acceleration plan. The initial objectives were to move 2014 to 2020 from an industrial part of GDP of 14% to 23%. And by the end of the program, we reached 17% of GDP. Now the question is, are those 17%, is this positive evolution only tributary, only due to the program, or other variables? For instance, if we're talking about a plan, a 5-year plan for agriculture, let's imagine that during those 5 years, the rainfall was below what was expected. There was a drought. So maybe we would end up with a negative outcome of that policy. So maybe we would be wrongfully thinking that that policy didn't work. Or in the other case, if the rainfall was quite better than expected, maybe the results would be very positive, and we would think that the policy worked very much, whereas the influence of other factors intervened. So this culture of performance towards which we are going, and through which we intend to thrive and to transcend the difficulties of our in terms of competitiveness, etc. It should be accompanied with a valid set of tools. So otherwise, we would have, as I mentioned, the performance, an unstable performance mapping, cartography, which is something that we notice in some departments in light of this new organic law of finance, where the indicators of performance tend to change from one year to another, which isn't helping with this, with the follow-up of policies and of course the natural selection of the best ones, keeping the best ones and leaving the least effective ones, leaving them behind. Also, we need money. We have ambitious plans. I'm talking about an ambitious, for instance, an ambitious universal healthcare plan in Morocco, which is going to cost more than 50 billion dirhams only in the first year, in the first phase, which is tremendous, and this required funds. And one of the best ways of getting those funds is by improving our tax policies, because for the moment, according to many reports of government institutions, the tax policy is quite inefficient. So we need to try new policies, and we need to evaluate them properly in order to improve that the revenues, public revenues, to fund those tremendously ambitious and positive policies. We also need to expand the tax base. Around 6% of companies pay more than 90% of company taxes, and this is something that we should work upon. But maybe if we try a few tools and we test the validity of of some of them on the Moroccan mindset of small companies, etc., etc., it will be a path worth exploring. Also, when we talk about money, we also talk about how we should use money in a rational way. So even spending should be rationalized. I'm talking about procurement, etc. So there is this need, and necessity is mother of invention. Also, as I mentioned briefly earlier, this new organic law of finance is providing us with the legal framework to go further in terms of policy evaluation, because now the budget is given based on a program, based on a policy. So and each policy has a performance project, let's say a series of indicators, etc., and also a performance report at the end, which means that we will have to, and we are doing a policy evaluation right now. And this should improve accountability. This is also important for our model of governance, for our model of democracy, by providing a better and precise and accurate information to the parliament members who are representing the Moroccan population. And of course, it is important to have, or to at least get acquainted with policy evaluation techniques at the Ministry of Finance, because we are involved. Whenever there is a big project policy, there is money, there is funding. Whenever there is funding, there is the Ministry of Finance. So we have a central role through all the stages of policy shaping and policy, evaluation. I'm going to cut to the chase and start with some basics, so that we understand the basic concepts. So I will start with the first thing we try to do through policy. We try to generate a causal effect. When there is a policy against analphabetism, we try to reduce, the rate of analphabetism. We try to, so there is always this causal effect that we are trying to have, this impact. So call it intervention, policy, program. We are going to start using the word treatment, just like in medicine. Treatment is the policy, the intervention, etc. And we are trying to understand, to assess, to evaluate the impact of this treatment on our target, whether it's the companies or institutions or citizens, etc. However, there is always a risk of having external factors, external influence. And remember the example I gave about the five-year agriculture plan, and if there happens to be a drought or high rainfall, this is an external influence that should be included in our analysis, and its effect should be isolated as best as we can. This external influence is going to be called confounding factors, because it brings confusion. So we have a treatment to generate an impact, but there's also confounding factors that could also influence either the impact or the policy. So those are the basics. And there is this really important concept. You see the word counterfactual. This is what this whole presentation is going to be about. Because, okay, so let's go back to the industry plan. So in 2014 we had a part of GDP given to an industrial part of GDP of 14%, and now we are at around 17%. So the question is, what if we didn't do the industrial acceleration plan? What would have happened if we didn't do that? So, because that's the only way we would know what is the real impact we've had. Like, if we didn't have the industrial acceleration plan, would we still be at 14%? Or would we still evolve somehow thanks to the spillover effects of other policies, or maybe some investments that came along the way, etc. So, and because we cannot really be in two parallel dimensions at the same time, where the same sector undergoes the policy and the same sector doesn't undergo it, and then we compare, we need to find ways of finding how to estimate this counterfactual so that we can know exactly the impact. One of the possible ways of doing so is by by having this sort of like in medicine, when they give the treatment to some patients and they give the other patient placebo, like candy or like vitamins or whatever. And this way you have a group of people or individuals or institutions where you do the policy to some and you leave the other ones without the policy. And then the other ones that didn't receive the policy can be an estimation of what would have happened if the ones we treated didn't receive the medication. And it is something that is quite common in medicine, and it's also it was also used during the COVID-19 testing period. Here we need to be really careful to make sure that the ones in the control group, so treatment group, are the ones that receive the policy, let's say the pilot of the policy, for example, and the control group are the people that do not, people, institutions, companies, no matter what it is, so that it is the group that doesn't receive the treatment, and we call them the control group. Okay, they need to be similar, otherwise we might have a biased evaluation. Biased evaluation, this is a really important thing as well. So because when we have a biased evaluation, we get an ill-advised decisions, and we are trying to find ways of informing our decision makers how to make the best of our policy toolkit. So we lose time, we lose effort, we lose money if we don't have proper like a good policy evaluation. And bias can really jeopardize the accuracy of those policy evaluation techniques. So basically, there are two kinds of biases: selection bias. For instance, let's say a program. We think that a group and like a control group, a treatment group are similar, but initially there might be a selection bias in the sense that the people that get treatment, they have to have something, a plus, like a motivation, or they need to have a high risk or something. So basically, we might and we will discuss this selection bias further and in the upcoming slides. But let's just get the idea. There might be some selection criteria for the people or institution to go into the treatment. So it is not logical to compare. It's apples and oranges. And there's also omitted variable bias. And I'm talking about, do you remember when I talked about external factors like drought, rainfall? Well, let's imagine that external factor is asymmetrical. For instance, the rainfall, we are working with two regions. One is the Susmesa, for instance, is the treatment region, and the southern eastern provinces are the control group. So maybe the rainfall doesn't fall in the same proportion. So it's an external factor. We are giving investment, etc. But there is an external factor, which is rain, which is not distributed evenly. This means that there is another variable in the model, and we forgot about it. We omitted it. So those are the main biases. And of course, at the end of the process of policy evaluation, this concept of validity is just like we're saying if this technique is worth it, is reliable or not. Internal validity is just when you control for those biases. And yeah, it's basically it. And I have just one recipe right after this slide about one of the best, or let's say the best technique of policy evaluation that really has a strong internal validity. And then there is the external validity, which means, for instance, that we do a study for a group of communes and we get the results. The external validity is to which extent can we say that these results apply to everybody else, to all the other communes or in other countries as well, etc. And this is something that can be verified if we do a replication of the same policy or policy evaluation. We replicate the same policy evaluation in other regions, and if we find the same results or similar results, we can say that this technique or this policy evaluation has a strong external validity. So we'll be exploring 5 techniques. I will start with the most effective, with the best one, and then secondly I will go to the worst one, and then a realistic one, differences, and then I will briefly go through another one that isn't that bad, that good, but it's good to keep in mind, and then I'll end up with explaining the regression discontinuity design, which is very interesting for procurement auditing and also for tax policy evaluation. So randomized control trials, as you can see, I put an image of dice, which means like it's random. So again, we are going back to the concept of counterfactual. What would have happened if we didn't do the policy, okay? And again, to the control group, the ones that didn't receive the treatment, and the treatment group, okay? So here we create the control group and the treatment group, not based on some logic, but only based on random selection. We just put, let's say we have 100 individuals, and we make sure that they are the same, or they have similar qualities, observable qualities and variables, right? So we have this a group of individuals. So we need to have, let's say, 50 in the treatment group and 50 in the control group. We don't select, we just put them in a software or like some sort of a lottery, and we just send them randomly. This way we can get a similar, similar features in two groups. We can say really that they are the same. Why? Because obviously the observable characteristics like education level, degree, age, group, etc. We already observed that, and we are making sure that we have an even representation of all the group, right? But at the same time, there are unobservable variables, like I said before, of motivation. We don't really know what is in people's minds or in companies' intentions. But the distribution makes sure statistically to control for those risks. So basically, after doing this exercise, and it is really important to emphasize that this technique, you can only do it if you start the design before the policy is being implemented. So, for example, it needs to be in compliance or like in collaboration with the institution that is going to do the policy, and we start the policy evaluation and the policy at the same time. So any difference that happens later is going to be tributary to this policy. So just quickly, there are many ways of doing the randomization. You either do it, you take the 100 people and you just throw people here and here, or you do by like you take the female subgroup and then you do the random, the male random, etc. Or there is the clustered randomization where we instead of going, for example, through individuals, we do it through like villages, or in the case of some companies, let's imagine that we do a policy, a tax policy where we try to get companies to pay a little bit more taxes or to review their declaration by sending them a message stating that there is a high chance that they will receive a tax audit. Here, small companies usually they don't do their accounting. They have a fiduciaire. They have this tax accountant who does the accounting for different companies. So basically, if we contact a few companies and we let them know, they will contact the tax accountant, and the tax accountant will likely do the same work he will do with those companies, along with others that didn't receive the treatment. So in order to control for this spillover effect, instead of randomizing through companies, we randomize through tax accountants. So instead of sending this company here, we send this accountant and everybody, in all companies that he's working with here, and this one here. So this is just to get an idea about just the randomization process, and it's also possible. I have a list at the end where you get an idea about how it is done technically. So basically, we just want to explore very briefly the concept so that you get it. So in practice, there are a few applications of this technique, and one of them, interestingly, is in Morocco. It targeted the Taysir program, and it wasn't it wasn't done by it was done by a group of economists that work with GPAL, and basically they followed the pilot project that the government did and studied the cases of 260 schools. So basically the results they imply that this program, which consisted of giving a small amount of money to parents so that they keep their kids at school, it had an effect on the importance of school, even in the mindset of parents. Like parents tended after this program, or let's say the ones that were treated, that received this policy, they tend to evaluate, to think that education is a good thing. Is, you know, they have more esteem for education than before. However, we need to bear in mind that the Taysir program, in its most part, is not conditional. It's not strict. It doesn't give money as a condition by keeping the kids at school. It's rather open. So they state that, you know, if the amounts of money, which are quite small, if they are bigger, they will generate a larger effect, obviously, and also if that money is actually conditioned, if there is some follow-up to make sure that the kids stay in school, maybe the impact would be even more important. I will give a couple of more examples, and maybe I can open the floor if there are any questions at this level. So those, I will just go ahead and explain those all the cases. They were done in other countries, obviously, and I just want to state that there is a large number of studies and a large number of countries that have been doing this randomized control trials technique, mostly to evaluate the impact of their tax policies, to go back to why we need policy evaluation techniques. The idea here is we just want to test whether sending a text message or a letter to some taxpayers changes their behavior or their tendency to pay taxes on time or to review their declaration, etc. So, and it's like a plethora of studies. I've put some in the reading list at the bottom that I will get to share with you in case you want to see further into the details. And it's in different countries, of course. There's also the case of public procurement. This one is quite interesting. I took this one from Brazil, where they send messages stating that there is a high risk of getting audited when it comes to procurement plans at the local level, and that, you know, when there is an increase of the audit risk, there is a significant impact on the reduction of corruption, embezzlement, but also mismanagement at the local procurement level. So I will open if there is.
Yes, thank you, Mr. OUKHALLOU. As we said when we prepared this session, we can open the floor to debate, just to discuss about the 2 points, and to give you the floor after that to discuss about the first point, why we need policy evaluation, and to discuss about the best tools, randomized control trials, as you said. So I give the floor to the participants to ask a question, suggestion, clarifications, maybe about examples said. And so you can just raise your hand, and the organizer will open your mic. So just raise your hand, okay? If anyone wants to participate.
I think
we have Bushra. Bushra. Bushra bin Muhammad. So we do have Bushra bin Muhammad.
Good afternoon.
Good afternoon.
I'm Bushra bin Muhammad from Budget Department. I would like, first of all, to thank our lecturer for the good quality of the delivery. I would like just to ask about the role of policy impact evaluation assessment in responsibilization and accountability processes. I'm not sure about the translation of the term accountability. It's la reddition des comptes in French.
Yes.
So just my concern is that the time span that some policies require for their full impact to be felt can be long, or they take too much time to work effectively. And especially for certain programs like education, maybe environmental impact of some public actions. The real goals could not materialize for years later or for decades even. And even some negative spillovers, some negative externalities might occur due to a specific policy, for example. My question is to what extent these tools might be useful and relevant, especially because politicians or decision makers that may take some actions, some public policies in, for example, some years ago, wouldn't be re-elected, or they will not be in the government, for example, when the results of the policies are so the question is to what extent these tools might be relevant, useful, effective to ensure a good responsibilization and accountability processes. And thank you so much.
Thank you, Bushra. Maybe I can let you, Dr. OUKHALLOU, answer to this question because we have only this one. But after that, we can answer to all the question in the same time. So
okay.
I think you have the floor.
Okay. Thank you very much, Mrs. bin Muhammad. It's a very consistent question, actually. Yeah, the link with accountability can be, can seem quite not so straightforward when it comes to long-term plans. I absolutely understand. The basic idea is that as you see here, we're talking about control group, treatment group. Usually, this happens in pilot projects. Usually, not always, but it can also apply to proper projects where you have to, but you have to find a control group. So it means that it might be before going to the full extent of the project, you start by doing a pilot project in one region, for instance, and then you control for the impact by using another region. And now some policies can yield results very quickly, let's say, and at least partially. We don't need to know the full extent of the program. This is more of a policy, more of a helping tool for policymakers, in the sense that you start with the pilot project and you do the evaluation at the same time, and then you realize that this action is working more than this one, so you adjust midway, and at the end of the pilot project, then you can state with the full knowledge of the evidence, based on the evidence, that okay, these are the actions that we are going to implement at the national level this time. So this on one hand. On the other hand, of course, some policies, especially as you said, when it comes to education and the environmental impact, they could take decades to unfold. And sometimes it's not even really easy to detect that it was caused by that specific policy, because there is an overlapping implementation of other policies, etc. But what I would say is that at least on one hand, we have a few techniques that can help adjust the program at the pilot stage, and can also help evaluate the impact and at least isolate some confounding factors that can be used sometimes by political decision makers to make it show that they had a bigger impact than what was really in the field, on one hand. On the other hand, it is also a technique that's it can take the time. It doesn't mean that we have to evaluate now. It's something that sometimes evaluation of a policy could take also decades, just as long as we make sure that we are following the proper tools to generate accurate results. Then then we would be in the right path. But when it comes to accountability, I do understand that when there's a program that is 10-year long, where it's obvious that it's not going to be easy to evaluate or let's say to link the responsibility if that government is no longer there. And so as much as it is it touches the policy evaluation, it touches the policy itself. So it's linked, it's correlated with the fact that those long-term policies cannot, maybe the government cannot be there to say that they did this or did that, or didn't do this or didn't do that. I hope this answered your question.
Thank you.
Thank you, Dr. OUKHALLOU. I see that Mrs. Ashiri Bushra has difficulties to raise her hand, but I can give you the floor, Ashiri Bushra, to ask the question. By the way, before give you the floor, I want to thank Dr. OUKHALLOU for giving us this document. We share it with all the participants. Impact evaluation methods in public finance, made by Dinya Pomerantz from Harvard University. Yes, we share it with all the participants as to give them an idea about randomized evaluation and comparison with other methods. So thank you so much. So I give the floor to I want to say that all the participants who has this kind of difficulties or technical difficulties, issues, you can write your question in the chat, or question and the answer. You can write and we'll ask the question. So Bushra, you have the floor.
Thank you, Sonia. Can you hear me?
Yes, go ahead.
Okay. Thank you. First of all, I would like to commend Dr. Khalid for his brilliant and very interesting presentation. This is just the beginning, but still we can see obviously that it's going to be very interesting. So thank you, Mr. Khalid, for giving us this opportunity to share with you this very interesting information.
Please, Bushra, could you just introduce yourself before asking your question?
I'm Bushra Ashiri. I work in a state-owned and public and privatization department in the Ministry of Finance. I'm a head of communication and external relationships in this department.
Yes, and I can add that you animate the last webinar on Thursday.
Yes, Sonia, I have the privilege to animate for last week. Thank you, Sonia. So my question is for Taysir program. If you may, Dr. Khalid, if you may, can we return back to this slide to see?
Dr. OUKHALLOU.
Yes.
Sorry.
Yes, for TAYSIR program, I want just to understand what you were saying. It's that randomized control trials has worked well for TAYSIR program. That's what you wanted to say?
Well, I wanted to say that a group of economists they did a study using randomized control trials to evaluate TAYSIR program. So basically, the point I'm trying to make is that it is a technique that can be used in Morocco and was used to evaluate, like the example of the TAYSIR program.
Okay, and have you an idea about the findings behind the use of those trials on TAYSIR program? Did you find some interesting finding about this topic or this issue?
Well, are you talking about the technical side or the outcome of the policy?
The outcome, if I can get the both, it's gonna be interesting.
Okay. Yeah. So the interesting thing about the TAYSIR program is that it was a large scale program, and where its pilot project targeted a few thousand kids, but at the same time there are other kids in rural areas mostly that were not yet targeted by that program. This was a very good opportunity to run this randomized control trials, because you basically have a large number of population that is more or less similar. More or less, they are youngsters who live in rural areas and who are studying primary school, right? So it is possible to easily do a distribution and have a control group and a treatment group. You will see maybe later when I cover other techniques that it's not always possible to do such things. This is for the technical part, and the interesting thing about the study is that they worked with the government. So before the government started doing the policy, they advised the government where to go, etc. So the choice of the pilot project by the Moroccan government was based on the randomization done by this team, and this team, by the way, included also Esther Duflo, who is a Nobel Prize laureate from 2019. It was a very good opportunity because you have a lot of data available, and before it starts, they decided which group is going to receive the treatment, which villages, and which schools, which basically means which villages, which schools are going to receive the treatment and which are not going to receive the policy during the pilot project, of course. And this is important because based on the results that were given here, the policy was expanded. So as you see, it was in 2015, a while ago, and the results I tried to put it in a very concise way, is that they noticed that the effect was very significant. They did some evaluation, quantitative and qualitative evaluation with the parents of the kids that received the treatment and the ones that didn't, asking them about how important they value the education of their kids, instead of for example staying in the village and helping with the fetching water and plowing the land, etc. So, and they noticed that there was an improvement within the treatment group, that the parents realize more, they value more education. This was it was based on survey, of course, but the issue is that the impact remained limited for two reasons, because the amounts are very small. It's like 100 dirhams a month, so it's quite small. And then you also don't have this condition, so it's not conditioned. So it's not like I will give you, okay, you have 3 kids, we will give you 300 dirhams each month, but under the condition that you keep them in school, and we will make sure through the local administration, a representative, etc., we will make sure to check on them. And because as soon as we will know that you're no longer taking your kids to school, we will stop that. It wasn't stringent, strict, etc. So they emphasize that it should be a little bit more conditional. And I think I'm not sure. I should, so please take this statement with a pinch of salt. I think that the TACI program now has a part that is conditioned. It has a part. It has two. It has a cash transfer, and it has also another part that is in this large implementation of the program.
Yes.
Thank you. Thank you so much.
We do have 3 other questions. We have Ikram, Makhzen, and Mr. Khazazal writes a question. But I invite you to continue the presentation as I encourage all the participants to ask their question in the end of the presentation, so as to have enough time for all attendees. Thank you.
Of course.
So, Ikram and Makhzen, we return back after.
Okay, of course. And all right, I'll start the timer. Okay. So we explored briefly. It's just a brief exploration. It doesn't, it is fine if you don't grasp all the different sides of the concept. And by the way, as Mrs. Mahmoud stated, that paper that we will share with you actually is very pedagogical. It explains in details and gives examples. It's really good for an introductory or an exploratory reading to understand a little bit better. And then you can go from here. What I would like you to take away from this is just at least to get acquainted that there are other possibilities of evaluations other than the ones that we usually do. And this one I'm going to cover now is the one we usually see or hear or do in Morocco. In my opinion, but it's also based on evidence and on literature. This is the least reliable one. This is the least reliable one, just to put it nicely. So it's a very simple methodology. You compare the group of companies, people, institutions, or whatever that received the policy during the pilot project or during the whole project, and you compare them with others that didn't benefit from the policy. But here, you just make the assumption, as you see in randomized control trial, we control for both observable and unobservable characteristics in order to make sure that both groups are the same. Observable because we put with the same level of education here and there, etc., right? And unobservable, like motivation, etc., the things that we cannot see, we control for it by being random. This is a statistical technique that yields very good results. Here, on the other hand, we are just making the assumption. We just assume, or suppose, we assume that both groups are similar, and that the control group, the people that didn't happen to receive the policy, are a valid counterfactual again. What would have happened? Remember, counterfactual of what would have happened to the group that received the treatment if they didn't receive treatment. Here, it's an unrealistic assumption, because sometimes, to go again to the selection bias, that we talked about before. Let's assume that we did a tax policy, okay, a tax audit program that aims to improve the taxes paid by companies. And we will start obviously with the ones with the high risk, where we see discrepancies, differences between what they declared and what we think have in terms of sales or results. So basically, the policy would have had a selection criterion. Sorry. So if you just come at the end and you say, okay, let's see what did we do. Like the tax administration is going to be okay, bring me the companies. Okay, let's see how much their tax, how much they paid in terms of taxes after we did the audit. Okay, just give me some random 500 companies. Usually those random 500 countries that didn't receive the treatment, logically, they wouldn't be, companies that had that had high risk. So there was a reason why, in the first place, we chose to apply our policy on a given group of individuals, of companies, etc. Right? And the fact that we just assume that they are the same is not realistic. That's basically the idea. So there is this example, or let's say this variant of simple difference, which is the comparison between the pre-policy and the post-policy within the same group. So we have the example of the industry. We take the industry as a whole and we compared it before the industrial acceleration plan 2014 and 2019 or 2020. Okay, so here it's basically the same idea. You just put what happened minus what was before, and it's a before after thing. And it is also limited because, as I said before, we might have, I have. So let's assume that in 2019, okay. So we're trying to see to contact companies. Let's assume that this is policy where we contact companies so that they submit, so that they review their declaration and maybe pay more taxes because we think that they under-declared. Okay, so the policy, let's say we applied it starting from 2019. Okay? But here, for instance, like the group, let's say A is the amount they paid, taxes they paid in 2019, and B is the amount they paid in 2020. So here, if we do a pre-post comparison, we would find ourselves with a policy that had a negative result. Like, how come we went to the companies and we, like in 2019, they paid, say, 100 in total, okay, 100 billion or whatever, and then after we went to visit them and we did the audit and everything, and they pay 80. What happened? What happened is the COVID-19 crisis. This is what happened. So basically, 2019, there was an external factor that made this pre-post comparison seem worthless in terms of policy implications. Now, for instance, what would be a better alternative is, imagine, so we did that, okay, they paid less, okay, they paid B instead of A, instead of doing better than A, okay? But we have a group of companies that didn't receive, just like the example I gave you, some companies, those random 500 companies that the tax administration said, bring them so that we compare and so that we show that we did a good job. All right, we bring them again, and we see that they did worse, than the companies that we visited. Now the impact wouldn't be the difference between B and A. That would be unfair to the tax administration because they did an effort, right? The impact would be the difference between C and B. And this is, if you think about it, it's a combination of pre-post comparison. So we're comparing 2020 with 2019, right? But at the same time, it is also a comparison between a group that received the treatment and another one that didn't. And this brings us to difference in differences. Like in my opinion, difference in differences is the most, so we saw the best one, we saw the worst one, right? And this one is, I think, is the most realistic one, because we in reality we don't always get to design the evaluation technique before the policy starts. Sometimes the policy is already, is ongoing, and then we have to evaluate. So one realistic way is by doing the differences. So it's a combination of this, as I said, between simple differences and pre-post comparison. Here, just bear with me that we are comparing between the change that happened at the treatment group and minus the change that happened at the treatment group. We are comparing between changes. This is why it's called difference in differences, because between last year and this year, my company, like company A, did had an evolution of sales. company B also had an evolution of sales. So we put this evolution at the A level. So how much did it increase? And then how much did the other one that didn't receive treatment increase? And then we do the difference between the two. I hope this is making sense to you, and please feel free to ask me if it's not clear enough. So we are comparing between the differences, the difference between time. We're comparing between them at the, at the control group level and at the treatment level. You can see it in this diagram. So it is actually, so the treatment group is the red line. So it had evolved starting from a point, but there is another group that's we didn't treat, the control group that didn't receive the policy. And then we actually make the difference between their evolutions over time. In practice, there is this interesting study actually, where they tested whether when we do an incentive to final customers, to final consumers, to ask for a receipt at a store, a retail store, if it pushes a little bit the companies to improve their declarations in terms of sales and taxes. This one is an ideal case where you apply the difference in differences. Why? Because look, we look at, I mean, they looked, she looked, Naritomi looked at the evolution at the retail companies level before final customers started asking for receipts, and after they were asking for receipts. And by the way, one of the incentives maybe of getting final customers to ask for receipts is maybe by doing tombola, lotteries, etc. So you are incentivizing them to ask for the receipts. And when customers ask for receipts, it might be an incentive for the company to be more transparent. Okay, so basically compare before and after, and at the same time they needed to find some group, because that policy was not applied as a pilot project. It was applied at the nation level. So they had to find some other group, even if it's not 100% similar. So the companies they took are the wholesale, les grossistes. So they took the wholesale where there is no final customers, and they put them as a control group, and they did the difference that happened, the evolution that happened within the wholesale companies in terms of tax declaration, and the difference that happened within the treatment group, the retail companies that receive the treatment with time, and then did the difference between those two. And it shows that there is a significant impact when you get customers to get this culture of receipts. And maybe through your experience, you notice that in Morocco, we are not really into that culture of getting receipts. So maybe this is one of the ways to explore, maybe. But if we are to do such a thing, we should make sure to evaluate the policy as we go, maybe at the early stage, at a region or a sector, etc. There's also another case, I will go to it very quickly, in terms of procurement, les marchés publics. So this case was done. This study was done in India and Indonesia, and it basically aimed to evaluate the impact of the transition towards e-procurement and its impact on cost and quality. Now, again, the advantage here in those two countries is that they didn't do the e-procurement at once. They started doing it at the regional level. So some states, because they have this federal system, it doesn't matter. So some regions started doing e-procurement while others didn't. So basically, you have a control group, right? All the regions, but like, is Souss-Massa the same as Tanger, Tétouan, Hoceima? Not really. So they're not very similar groups, right? But we took them as a control group, and we did it before, after, in every before, after, and in both levels, control and treatment. The peculiar thing, the result is that they found no statistically significant impact on the cost, but they found a substantial impacts in terms of quality. Now, quality was measured through a few indicators, such as the delay in terms of the execution of infrastructure like roads, etc. Because they, according to their manual, in, for example, India, corruption risk is linked to projects that get stopped halfway or that take longer than expected, like too much longer. So in terms of delays, it had improved significantly, and also some other indicators of quality. And another significant finding is that there were more tenders, more tenders coming from other regions. You know, so we're talking about the regional level, so other regions. So they managed to get the best, you know, the best. And of course, when we talk about quality, if you get a better quality with the same price, it's just like if you reduce the cost, actually. Now, we'll go through this one, matching, very quickly. It is not, it has its limits, and it's not really important to bear in mind, but it's good to at least keep this technique. So matching is, if you remember with the randomized control trial, we just do it randomly. We don't choose which one will go where. We just like run a software. We just do like a head or tails, or like we do dice. It's random. But here we try actually to select people. Now we have 100 people who will select them. Also, okay. So this one has is in the 50s, like in terms of age, 50s. The income level 10,000 dirhams plus a month, okay, and he has I don't know, a PhD, okay. So we take this man, we put him in the treatment group. We need to find another person that has the same characteristics, observable characteristics, not unobservable. We remember, we don't really know what is happening inside the person, or what is in their family, etc., etc. So we try to match. We take one person from here, we find another person that is similar to them, and we put them in the control group, so that at the end we will have two groups, one that will receive the policy, or maybe that one that had already received the policy. So this one doesn't need to start before the policy. So and another one who didn't receive the policy, and you have those two groups that are similar at the observable level. Now the issue, the limit with matching, is that it's not possible to control for unobserved variables. So, and usually, as I said before, the selection bias, sometimes or often there is a reason why we chose that person or that company to receive the policy rather than the other one. It's not always just like random. So maybe they are at a high risk of corruption, or at a high risk, or you know, and even when it comes to procurements, you know, some procurements have, you know, a large amount, so maybe they are at a high risk in terms of you know, impact, while others. So it's not possible, you know, to control for unobserved variables, which we controlled for in randomized control trials by being random statistically. And also, when you have like 10 criteria, it's difficult to match one person with another person that has the same criteria. It's just like dating. You have a person that has, you know, a certain number of features, and you are trying to find the perfect match over that person. It becomes harder and harder as your criteria increase, as you keep getting more criteria. So just briefly, and this one is the last one I'm going to present to you. It is a very interesting one. So far, I want you to remember the randomized control trials as being the best one, right? And it is used in medicine a lot. It is inspired by the medical trials. Okay, that's the best one. The realistic one is difference in differences. It is quite good. It generates reliable results. It's good. And this one is interesting when we have a threshold. Threshold is like when you have, for instance, in public procurement, when the amount of the contract is 5 million dirhams and above, it is eligible for audit. So the threshold, le seuil, is 5 million. So, and also in taxes, we have a lot of thresholds in taxes, in rates, etc. Right? So when you have that threshold, how can we really find a control group and a treatment group? The idea here is very simple. You take the individuals that are just a little bit above that 5 million, for example, threshold. It's like 5,000,001, I don't know. So you take those individuals just above, and those are the treatment group because they will be audited. And you take the ones that are just below. And the assumption number one is that those individuals or procurement contracts or whatever that are around a little bit above and below the threshold are similar, are the same. That's the first assumption. Second assumption is that there is no strategic change in the behavior of maybe the people in charge of the procurement around that threshold. This can be illustrated here. So you have a cutoff, you have a threshold, and you have individuals without program. Before that, 5 million, imagine it's 5 million or 30% or whatever, or 20,000 dirhams for the case of tronc commun in the modulated expenditure control. And you have the ones that received it. So in practice, this is very useful when we are working in terms of procurement auditing, and you want to evaluate whether this procurement auditing is yielding results or not really, not quite, or maybe how we could adjust maybe the cutoffs and the practice and the methods, etc. So there is this case in Chile, and this is quite common. Those techniques are quite common in Latin America and in South America, and countries like Chile have similarities with the Moroccan framework, which is, and this makes this kind of studies very interesting to observe, because it could have, remember, external validity. It could have implications on how policy, if we do that, how it would work in Morocco. Of course, again, the exact reference and the complete title is going to be communicated to you at the end. So here they examine those cutoffs in the audit probability. So in Morocco, I said the example, when it's like a normal contract, it's 5 million, right? When it's negotiated, it's 1 million. And when it's local level, it's 3 million for auditing. So when you are beyond that threshold, you have a high probability of being audited. It's not systematic because we don't have enough resources to control all the procurement contracts that are beyond that threshold. So they examined just the ones that were below and the ones that were above, and they are controlled by the controller agency. It looks a bit off, but this is exactly how it's written. It's just like le comptable public, the public accountants, and in the post control and in the a posteriori control, I like the IGF. So this helps with. It has been helping with how to optimize the methods and whether to adjust those cutoffs. Because in Chile, they don't have fixed cutoffs. They have some indicators, and based on which they calculate where the cutoff or the threshold should be. So they are adjusting based on the results of the study. To wrap up, I present to you like the main features of each technique. As you can see, randomization is the gold standard. It's the best. It's the most powerful. And if you have randomized control trial, nobody is going to question your methodology. Nobody is going to question the reliability of your results. But it is also difficult and not always feasible, and also not always ethical. Okay, can you imagine? So you go to Central Africa, for example, and you are trying to see the impact of small public health measures on the spread of malaria. Small public health measures like bed how do you call it? Bed sheets or bed nets. Sorry, bed nets. Like how to protect against mosquitoes on the windows, on the beds, etc. And its impact on malaria. And then you have to choose. Okay, so we have 50 villages. Okay, so 25 villages are going to receive the treatment, and 25 are not going to. So it's not ethical in the sense that you are depriving people. You might be causing the death of some people because you just wanted to test how effective is your policy. And it could also be, unethical in the case, of Taysir, for example. So you are talking about some kids that are probably not going to go to school because you wanted to test the impact of your policy. It's so difference in differences. It's feasible. I mean, there is a risk in case there is a major change of trends, but this is also something that you can talk about. If you cannot control it statistically, at least you can specify it. And it doesn't always happen. It's realistic. Regression discontinuity, as we said, it's really interesting when you have a threshold. Examine the ones below it and the one above it, and matching, which is that good, considering that we don't control for unobserved differences. So, the list, and I thank you so much for your kind listening and your patience, and also for your questions so far and the ones that are upcoming. Thank you very much.
Thank you, Dr. OUKHALLOU, for your clear and enlightening presentation. The relevant example was enough for us, I hope, to understand this concept. So we have some questions writing. I don't know if Ikram and Mr. Mahsen still want to say something. So I will read the question written by the participants. Okay. I don't know. I think I read that Mr. Khazaza asked question, is there more details on econometric techniques? But I don't read. So about econometric techniques. Of course, we use this kind of tools in our ministry as Directorate of Studies and Financial Forecasts. They use a lot of statistic, I think, and also Directorate of Budget. So I think econometric techniques are used in this kind of directory. Can you answer so as to give me time to read the other questions?
Okay. So yeah, of course, at the end you need to estimate a model, an econometric model, and in most of the cases I just presented, they usually use panel data modeling, fixed effect, mostly fixed effect, whether it's estimated through least the OLS, GLS, or Poisson pseudo maximum likelihood. So it's panel data usually. It's just like those evaluation techniques. They enable to yield the statistics that can be used for the sake of the estimation through econometrics model. Does that answer your question, hopefully? And of course, they use software such as R or Stata. It is and actually, randomized control trial is something that is embedded in Stata. I've seen the codes before. It is something that can be used, actually. Can be programmed in Stata.
Hi, everyone. Hello.
Hi.
Hi, Hi,
We
Mr.
cannot hear
Youssef.
you.
Mrs. Sonia? Yeah. Do you hear me?
Yes, I hear you. Just like Mrs. Hamamouche doesn't have the microphone on.
Ah, okay. Okay,
I
I'll wait.
don't know if she's talking to us.
Okay.
Okay. Just all right. Okay, it's fine. Go ahead.
Yeah, Mr. Youssef. Thank you, Mrs. Sonia. Thank you, Mr. Youssef, for sharing this sensitive but very important subject with us. The content was clear and very instructive. You spoke of the need to establish a culture of evaluation vis-à-vis the citizens, such as democratic debate, understanding of public interventions, transparency, etc. Personally, I think the problem is that we are more interested in the means than in the results in public administrations. As you know, the Constitution established evaluation institutions such as the Parliament and the Court of Auditors. And we all know that public programs are evaluated by these institutions. Mr. Youssef, as you brilliantly explained evaluation techniques with practical cases, my question is, in your opinion, what really is the problem? It is in the nature of evaluations technique or in the implementation of the recommendations results of the evaluation process? Thank you.
Yes, Mr. OUKHALLOU, you can answer.
Yes. Okay.
But
Right.
you know, before giving you the floor, I will read all the questions so as to have enough time. There is a question asked by Mr. Mahzen. What is the difference between policy evaluation and accountability? Maybe policy evaluation, we need to have it for accountability. So the next one, the question given by Mr. Mahzen. In fact, I want to know what is the rate of performance and in our Department of Finance. Mr. Mahzen is the head of accounting quality in GTK. Mr. Khazeza, with econometric technique, how can we correct the selection bias problem and the omitted variables problem? Mr. Khazeza, how can we eliminate econometrically the fixed effects when using D&D? So I will share with you the presentation after, I think, after the webinar. Thank you, Mr. OUKHALLOU, for giving us this reading list. It's very interesting. And the last slide, of course, you gave us this board which summarize all the presentation. But you know, it doesn't give us the relevant examples you give us. So I don't know if there is attendees who want to ask questions. Can you raise your hand? And the organizer will open your mic. Okay, I don't have this list. So I give you the floor, Mr. OUKHALLOU.
Okay. So I will start with Mrs. Ikram. I think you emphasized a very important point, which is about our transition towards proper evaluation techniques. Well, actually, in my opinion, I don't think the techniques are the problem. I think it just requires the political will. And in order to get the political will, you need to raise awareness among the 12 top management in different departments as regards to the importance of these evaluation techniques, or just say the importance of generating reliable information. So, and this culture of performance, I totally understand. You know, we've been working with this logic of means, this Keynesian logic of means for so many decades. It's a bit difficult. You know, the change takes some practice, and indeed we are evolving towards a performance paradigm, but we still notice that there is a little bit of resistance, but you know, it is a battle between the future and the past. Like for instance, like of course we are talking about programs, a logic through programs, and you know, policies, etc. But 40% of the budget way of the government, of the central government, the central state, is made of support programs, which is basically, you know, the same logic as before. So there is, but at the same time, you know, like 60% is actually going through, you know, gradually progressing towards a more of a program-oriented vision. You know, it is easy to talk about to reform laws, but the culture doesn't come. You cannot dictate culture. It comes gradually. So hopefully, as we have a favorable legal framework now with this new organic law, we will. It is possible to see an evolution in terms of practices, and when practices, there should be an evolution of the culture, I believe. So, because this transition towards performance is inevitable. It's because performance or performance-oriented public management is the future, and future always, you know, like future technology, future knowledge always beats past, you know, practices, etc. Always through history, whether it's in war or in politics or in diplomacy or public finance. So as I said, it requires political will, and you know, it should be you know, people like us in the Ministry of Finance taking the initiative to push all the departments, because we are involved everywhere. When there is budget, we are involved. So maybe it's important. Maybe, and I'm submitting this request to Mrs. Hamamouche to maybe go a little bit further with this, you know, evaluation, the techniques. Maybe we could do focus groups and work on policies that's already there, etc. It is, you know, something that we can explore together under your leadership. As for the question by,
good idea.
Okay. As for the question by Mr. As you brilliantly answered, Mrs. Hamamouche, actually, performance evaluation or policy evaluation enables to have an exact and accurate information to help with accountability. You know, because if you have accountability, okay, accountability, let's say, based on wrong information, that's not really accountability. It might be unfair, and sometimes it might some might get away with it, with their, I mean, get away with their lack of performance, their lack of, you know, effectiveness. The question by the second question by Mr. Khazaza, if I'm going to try, I'll try to answer based on what I understood. I understood that, like, through fixed effect estimates, how we manage to control for omitted variable bias and selection bias. Well, you know, the issue with these two is that they are linked in the case of difference in differences, right? Or let's say in any case. But I will give in general, and then maybe we can talk about the case of D&D. So actually, they are linked to the design of the policy evaluation, because I see this is how I see it. I see that the ID is a variable in the model. and then you have to add variables, hopefully, or eventually, or and control variables, etc. So basically, it is the data that you have that you generate through, so the observations, so the DID is actually there so that you can have observations on the variable of like the difference of, you know, in terms of a variable of interest, let's say declared taxes, etc. So how do you control with fixed effect? I think it's you cannot control with fixed effect the bias. If there is a bias in the design, there is a bias in the design, you will get the data and you can run the fixed effect, but there's a problem in the data in the first place. I hope this answers your question. Is there some other question? I think, yeah, for the rates, performance rates of the Ministry of Finance, well, I don't know which variable we are talking about, and honestly, I don't know, what is the rates of performance in the Ministry of Finance. Maybe we should figure that out through like one of the future focus groups, etc. Right? Maybe it's something we should look at, and maybe there is a statistics. There are statistics, but I just happen not to know what are the statistics.
Yes, thank you, Dr. OUKHALLOU, for your time and valuable insight. Thank you all for your listening and contributions. Let me now close by wishing you a delightful and stimulating week. See you next Thursday. So, have a good day. Thank you.
Thank you so much. It was a great experience, and I'm looking forward, hopefully, to attend all the seminars by other colleagues, and also to contribute whenever you deem it necessary. Thank you very much, and thank everyone for the really inspiring questions and comments. Thank you.
Thank you, Dr. OUKHALLOU. Thank you to all participants and for your contribution. Thank you to the IDF teams, Saeed, who is the organizer, Khalid, and all the teams. Have a good day.
Bye.